Recently, with looking after people with type 2 diabetes, we've changed the way that they are being looked after in Southwark. And most people who don't have complications of their diabetes actually said that they'd like to be looked after closer to home by people that they know.
I found it very difficult to manage until recently, in the last year. I had some support some extra support from the health centre.
And what I have to remember with my patients with diabetes is it's actually them that manages their condition. During the year, they don't spend very much time with us. But every day, if you've got diabetes, you need to think about what you eat, how much exercise you have, about your medication. And it's the patients that are managing their diabetes.
I was able to have one-to-one consultation on the way I manage my diabetes. And although I thought I was managing it all right, it wasn't quite what, sort of what I needed to do.
We do what's called care planning, and the patient and I agree what their goals are to keep their diabetes healthy in the future. And then I think, what do I need to do to help them, support them to achieve that?
But now, with self-management, or having had that support into how to manage it, then I feel much more confident and much better.
The response from patients have been very positive, and patients feel very engaged, and they want to talk about their experiences.
Now that the patients that really need to be seen at the acute hospital are the only ones that are going there, it's dealt with that bottleneck where they were absolutely swamped with patients who perhaps didn't need the specialist skills they had.
I think it's really what is needed in, say, a health centre, because there are so many people I talk to in similar situations, and they're finding things like diabetes and high blood pressure, and they're finding it very difficult to manage.
And we've also seen the very positive outcomes of patient satisfaction and improvement in blood glucose control. So I think we can learn from that and apply the lessons we've learned to redesigning care pathways for other long-term conditions.
I used to be always worried every time someone asked me out for a meal. I used to be worried because I never thought, take your tablet with you and you can do your self-management there. So yes, I feel so much better now and more confident, definitely.